So beginning, first thing you need to do is wash your hands before you enter the patient's room. After you do so, introduce yourself to the patient. Hello, my name is Rob Hibben. I'm here to start an IV on you. Make sure you have the right patient. Check their name band and make sure you're doing the right procedure on the right patient. So you need to assess for what kind of IV you need to start and make sure you have an appropriate site to do so. Things like injuries on the extremity, infections, AV fistulas, potentially mastectomies in women. Things like that will contraindicate starting an IV in that limb. So let us begin with the assessment part. First things first, so after you check your extremity, tourniquet on, nice and tight. Ask the patient to pump up their hand. Okay. You can relax now. Feel across for veins. So I can feel one there. I can see some here, some smaller ones. There's some hand veins I can go for, and there's a nice big vein right in here. It's probably a little hard to see, but again, you feel across the vein. It's not poking, it's feeling across it. Okay, so I determine where I'm going to go. I clean the site first with some alcohol. Followed by ChloraPrep. Okay, I will choose my IV device. I usually twist the catheter, that helps it be a little loose. Again, reassess, make sure I'm still in the right spot, everything's looking good. Tell the patient you're going to feel a big poke. Insert the catheter, looking for blood return. There we go, blood return. Advance the catheter. There we go. Once that's there, basically hands off at this point. We will draw blood. Pressure, 2 fingers. Disconnect. On nice and tight. And then you can begin drawing your blood. A separate technique for drawing blood, which some people prefer, is instead of using the barrel, they set up their buff cap, hook the barrel to the buff cap, and you can draw your blood that way. Once you've drawn all your blood draws, tourniquet off first thing. Again, make sure you're anchoring your IV so there's no movement. Tape it down securely. And finally flush with the solution of choice for your institution. And that's how you start an IV.